ever wondered why some medications take effect almost instantly, while others seem to work slowly, gradually? Or why different people can have vastly different reactions to the same drug? The answers to these questions lie in a fascinating field of study called pharmacodynamics. Pharmacodynamics is the science that deals with the chemical interactions between the body and a drug. It's a complex dance that plays out in our bodies every time we take a medication. It's not just about the drug itself, but also about how our bodies respond to it. Imagine a lock and key. The drug, or key, fits into a specific lock or receptor in our bodies. When the key turns the lock, it triggers a response. This could be anything from relieving pain to reducing inflammation, or even fighting off an infection. This is the basis of pharmacodynamics. But it's not as simple as just turning a key in a lock. There are various factors that influence how a drug interacts with our bodies. These include the drug's concentration, its affinity for the receptor, and the sensitivity of the receptor itself. The concentration of the drug is crucial. It's like having the right number of keys for a certain number of locks. Too few keys and not all the locks will be opened. Too many, and you could end up with an overdose. The drug's affinity for the receptor is another important factor. Some drugs have a high affinity, meaning they fit perfectly into the receptor and trigger a strong response. Others may have a low affinity, meaning they don't fit as well and may trigger a weaker response. Then there's the sensitivity of the receptor itself. Some receptors are more sensitive than others, meaning they respond more readily to the drug. Others may be less sensitive, requiring a higher concentration of the drug to trigger a response. So to summarize, pharmacodynamics is the study of how drugs interact with our bodies. It involves the concentration of the drug, its affinity for the receptor, and the sensitivity of the receptor itself. By understanding these interactions, scientists can design more effective drugs, and healthcare providers can prescribe the right medication for each individual patient. This fascinating field of study is constantly evolving, with new discoveries being made every day. Who knows what incredible advancements we'll see in the future? For now, though, we can appreciate the complex dance of pharmacodynamics that plays out in our bodies every time we take a medication. So next time you take a pill, remember, it's not just a simple case of pop and go. There's a whole world of science at work behind the scenes, ensuring that the drug does its job effectively and safely. And that, in a nutshell, is the magic of pharmacodynamics.